So thank you very much, Daniela, and the brokerage for supporting this, and thank you all of you who took some time this afternoon to listen to us. We're going to try to make it as entertaining as possible. Before I begin, I got to tell you that I've been lucky enough to have been working with Security Life for about 3.5 years. And I got to tell you that in the last 3 or 4 months, we really figured it out. I mean, we are selling about 1,700 policies a week, which is pretty impressive considering where we used to be. So that tells me that there is something that we're doing right. I mean, this is really working. And I think the reason why this is happening is because we're really focused not only on the product, but most importantly, on the selling process. We understand that dental and vision are not products that offer that are high premium products. Therefore, they're not high commission products. So for you to spend too much time selling dental and vision, it really makes no sense. But dental and vision, however, are a great opener. It's a great way to get to know somebody, especially the senior market. They have dental insurance through their employers for many years. They retire. Medicare doesn't cover it. And all suddenly, you know, that's an expensive treatment if you don't have insurance. So it's a great door opener. People ask for it all the time. Vision is also very popular these days. And we have seen that people that are embracing selling, offering dental and vision have not seen just the revenue from it, but they have also seen a lot of other business because of the cross-sell that occurs through these products. So please utilize that. Take advantage of these products. Call your clients. And most importantly, we have tools. We have emails, templates, and things that we can provide to you that you can simply send it to your potential clients or to your clients, existing clients, and everything is done for you. Because the tool that we offer you to sell this is a self-selling, consumer-friendly tool, which I am going to demonstrate in a couple of minutes as well. So with that, let me get into why Security Life and how we try to be a little unique, which is difficult to do because everybody wants the same thing. They want to go to the dentist, they want to show an insurance card, and they're hoping that the insurance companies pay for most of the bill. I get it, but this is what we did differently to help you with the sale. We actually target how do we help the agent not get so many objections, or how do we help you overcome the selling objections to make it extremely simple. So what we did is we offer products that are the same age regardless of age. So the same rate regardless of age. So if you meet somebody for the first time, you don't even need to know how old they are. You can tell them, listen, I have a product that works this way and it costs this much. And you know that because you know the rate in your area, you know the product in your area, and you don't need to know anything about the client to be able to tell them that. Other carriers I have seen, they normally have age-banded products, so the older you get, the more it costs. And also they have limitations where at certain age, they don't even offer it. With Security Life, you don't have to worry about it. Anybody can get it, and the rate is the same regardless of age. We also offer something, this is probably the biggest differentiator we have. We have immediate coverage for all the services, and this includes major services. And that's a big deal because major services by most carriers, the coverage starts a year later. And we don't have a day of wait. I mean, you can buy the policy today and it's available tomorrow because we also offer immediate effective dates. So you can, basically it's the next day actually. So you can sell the policy today, the client can go to the dentist tomorrow, they can get a crown done or oral surgery or something major, and they will have some level of coverage regardless. So no waiting period. That's the biggest deal. Then we also thought about enrollment fees. Well, you have to overcome that objection if we do them, so we took them away, no enrollment fees. To make you feel more comfortable with the sale, or to make your client feel more comfortable with what you just sold them, we also cover it by a 30-day satisfaction guarantee. So you can tell them, listen, if by any reason this doesn't feel right, you have 30 days to change your mind. You'll get a full refund as long as you don't use the policy. Once you submit a claim, it's not going to happen. And you can also, I also added this recently, you can sell only one line. But what I mean by that is that probably my biggest competitors out there, they have a DVH plan. dental, vision, hearing, which is great. They work very well for some people, but let's be honest, not everybody needs hearing, not everybody needs vision, or not everybody needs dental. So we offer the ability to sell only vision or only dental. Unfortunately, only hearing doesn't exist. But again, not everybody needs it, so why are you paying for something you don't need? That was the whole idea there. So just know that about Security Life. You can sell only one, or you can sell both of them. Let's look at the plans really quickly, and keep something in mind. When you buy a dental policy, you buy it to use it. Unlike other insurance where you're hoping never to use it, in this case, you actually want to use it. So you want that immediate satisfaction, right? I also feel that, well, I don't feel it. I went to the dentist, and I asked my dentist, doctor, if I come and see you twice a year to do my cleanings and my exams that you do and my annual x-rays, how much will that cost me if I have no insurance? And he told me that it was roughly about $400 to $450 for the 2 visits plus all the exams and the x-rays. I was like, okay, great. If I buy an insurance policy, I'm going to pay the premium, which is roughly going to be somewhere around there. And if anything happens, I mean, they're going to cover my preventive, and if anything happens, I'm going to have coverage. So it really makes sense to buy it because you're basically paying for the 2 visits to the preventive stuff, and you have coverage for major. And the thing is that if you don't have it, if you say, I'm going to self-insure, the chances are that you won't go to the dentist twice a year unless something hurts, and that's when issues happen. But when you pay for something, you're more likely to use it because there's an incentive. Hey, I want to get something out of it. I'm putting all this money into this. I want to get something out of it. So you're more likely to use it. So that's why it's smart to buy it, because it's going to make you use it, which in essence is going to help you not have issues later on and pay the big bucks. But anyway, the way we do it is we offer immediate coverage at 100%. Again, we want you to use this for preventive services. Your exams and your cleanings, we want you to do them, so right away, they're 100% covered. Then we have basic services. We started us at 35% day one. We increased that to 65% after the first year, and then we increased them to 80% after the second year. I'm looking at the Advantage Plus plan, by the way. That is the best plan we have. And then on major services, we start at 15% day one, which is pretty nice considering everybody else offers 0. And then we move you up to 50% after a year. Ultimately, this is going to be a 180-50 plan, which is what most people are used to. By offering this graded benefit that increases with time, when the client hits that 3rd year, or past the 2nd year, they don't really want to give it up because they're already at the highest benefit, so it helps with retention as well. The Advantage Plus next to it, the orange one, is almost identical. The only difference is that the basic services are not as strong, so the coverage is starting the same way, but it only goes up to 65%. And the major services, it takes 3 years to get to 50%. So it's 10, 25, and 50. If I were you, I will only offer Advantage Plus all day long to everybody. The reason why I say that is because Advantage Plus and Advantage, the difference in price is not significant enough not to offer Advantage Plus. We're talking about a couple bucks here and there. And really, why not offer the best benefit in case they really need it? You're talking about a few bucks. I mean, it's not that much more. So what I notice most agents are doing, and they're doing really well, is they learn the Advantage Plus really well, and that's all they sell all day long because it fits everybody. The Advantage is there as a backup in case you have a situation where, oh, this client really is having a hard time paying for this. Let's try to go as cheap as possible and at least get them some level of coverage. Okay, fine. But again, the difference is so insignificant that most people just sell the Plus, they learn one product, they keep the story very simple, they only offer one thing, and you're good to go. And that's what I would recommend doing. By the way, with the Plus, in a situation where you're selling this to a family with children, with kids, or perhaps it's a single parent with a kid, the kids will also have access to orthodontic services. So if you're working with senior market, it doesn't matter. It doesn't apply, so you don't even have to explain it. But if you have a situation where there is a kid, there is a waiting period on this part. That is the only thing we have a waiting period. And it's after the 2nd year, so after 2 years, each kid, in case of many, they will get $500 per year with a lifetime maximum of $1,000. So year 1, 500, year 2, 500, and then it's done. So it's a little help towards orthodontic services. It's nice to have. If you have 3 kids, the kids all 3 get it. If the annual maximum that you select, for example, is 1,000, then each kid will have, in essence, 1,500 if they use ortho, because it doesn't count towards your annual maximum. Now let's talk about the deductibles and the annual maximums. There are 2 deductibles on the plan. There is a $50 lifetime deductible on preventive services. All that means is the very first time your client goes to the dentist to do an exam and a cleaning, they pay $50, and that's it. They'll never pay again a deductible on preventive again. It's a once and done. In the situation where a client needs to do basic or major services, they will pay $50 on a calendar year basis. So basically, between January 1st and December 31st, if they go to the dentist, and then they go back over here. Let's say that they need to get a filling done, they'll pay $50. If within the same calendar year they need to do something else within basic or major, for example, oral surgery or a crown, they don't have a deductible because they already paid it under basic services. So it's a combined deductible, and only if they need it. The way I like to explain this is, client, you're going to pay $100 the first year, and you're going to pay $50 every year after in deductibles. It's as simple as that. The reason why I say that is because if you use this the way you're intended to use it, or the way that is intended, which means twice a year, go get your preventive and get your x-rays at a minimum, right? So twice a year, the first time you pay $50, and you're going to pay at a minimum $50 for your x-rays, because that's under basic services on this plan. So that's $100 year 1. Going forward, you'll never pay anything else on preventive. So if you do anything in basic or major, which normally you would, you'll do the x-rays, you'll pay $50. So 100 year 1, 50 every year after, keep it simple. In terms of the annual maximums, as you can see on the bottom, you can choose between 1,000 or 2,000 with either one of the plans. Now, if you choose 2,000, for example, go back to the plan. You can use the whole $2,000 if you want to on preventive and basic. So you could have, 7 or 8 fillings and your preventive, your cleanings and whatnot, and use the whole 2,000 on preventive and basic. The only thing is that if you want to use it on major services, you can only use half of the total maximum. So you only have 1,000 in this example to use for major services. Keep in mind one thing. Most plans offer $1,000 coverage. That is the known plan out there. So if you have a $1,000 plan with no limitation to major, you could use all 1,000 in major, but let's be honest, you also need to do preventive. So you got to get your exams, your cleaning every year. So that's about $400. You have $600 left for major services. With our plan, you can use the whole 600 or 400 on preventive. You can even use more if you want to on basic services, and you still have a full 1,000 on major services. That's how much stronger this benefit can be. And that's why we truly built a product that was strong in benefit, because we want your clients to refer you. We want your clients to talk to their friends and give you more leads to more business. Remember, this is not the product that is going to give you the big commission. It is not, because the premium is small. This is the product that is going to bring you more business. And that's how we were thinking about it. Let's talk about something really quick. A lot of you, especially if you work with the brokerage, because there are silos in Texas, the states above, Connecticut, Illinois, Missouri, New York, and Texas, these 5 states, when we filed the products, they told us that they wouldn't allow us to have any co-insurance that is less than 50%. So what we did is we say, fine, we're going to have to start people on the second or the third year benefit. So as you can see here, we start you at 50% on basic services instead of 35%, and we start you at 50% on major services day 1. That is a huge, huge benefit. The rate, it is a little expensive. I mean, it's a little more. It's about $6 more because you're starting on a much higher level of benefit. But wow, 50% day 1. You're telling me that you could sell this to a client today. They can make an appointment to go to the dentist tomorrow. They can get a crown done, and we'll pay for 50% of it. That's a huge benefit. that better be a happy client, and hopefully they'll stay a very long time with us. So just know that the benefits are stronger at the beginning on these states. After two years, that they are the same in everywhere in the country. By the way, the dental benefits or the dental plans that I'm showing you right now, they are available in 49 states. The only state that we don't have this version of plans is the state of Washington. So if you do business in the state of Washington, please reach out to myself or to our team after the webinar, and we'll send you the Washington plans. By the way, if you have questions, please send those questions to us. I mean, Daniela, I will provide the contact information later. Send the questions to us. Call our team. We'll be here to help you. Okay, so now that you are familiar with the plans, and you see how good the benefits can be, or the plan design is on these plans, easy to sell, you can sell these plans, and you can tell your clients, listen, you can go anywhere you want. I don't care who your dentist is. Go anywhere you want. You can go to Mexico. You can go to another country for all I care. Use the plan. If you're outside of the country, obviously you need to bring the proof, the receipts, what was done, and we'll reimburse you. In the States, most dentists, what they do is they submit the claim to us, and we pay the dentist, and whatever difference is not covered by the insurance, they bill the client. But you know, go anywhere you want. These plans pay based on the UCR at the 80th percentile. The UCR is the usual and customary rate in your area, so we're going to base every area is different. If you're in Omaha, Nebraska, it's probably a lot cheaper than if you are in New York, in Manhattan. So keep that in mind. But we're going to go by the UCR in your area. Now, we do have a network, and you can use that as well. And what we did is we call it the Advantage Plus Network or the Advantage Network. And I figured that by putting the title of the product, by putting the word network on the title, we couldn't make it any clearer. So if you see the word network, it is because we are going to pay based on the network negotiated price, the maximum allowable charge. That's what MAC stands for. And that's basically the rate negotiated between the network and the dentist. So we're going to base it on that, and I'm going to show you an example in a second. So if you look in here, the network that we use is the Carrington network. Carrington is a maximum care network, which is basically the Carrington network and the Dentamax network combined. So if the dentist is taking Dentamax, it's taking this network. If they're taking Carrington, they're accepting this network. They're pretty big in Texas, huge in Texas, but they're also pretty big nationwide. Their discounts are a little deeper than most networks. They're higher discounts, so it's more beneficial for your client. Some networks only go up to like 20–25%. These guys go up to like 40–50% in some services. So they're very, very strong networks. And I'll show you how to find them in a second. And in this example that they provided to us, you can see the regular cost column is basically the UCR nationwide. So the average cost, for example, for a crown nationwide is about $1,200, $1,168 to be exact. If you go to a dentist in the network, then dentist made an agreement with the network to only charge $758 for a crown. So they really reduce the rate by about 35%. Now, if you're the client and you have either one of the versions of Advantage Plus, for example, either the Plus or the network, and you go to a dentist in the network and the dentist charges $758, and you're at a 50% co-insurance, we pay half, the client pays half. So it will be $379 each. If you're out of network with the Advantage Plus and the dentist charges $600 for a crown, $1,200, we'll pay $600, the client pays $600. So you can see that it's a lot more beneficial for a client to go in network because it's less out of pocket for them. But let's be honest, not everybody's dentist is in a network. Or maybe you don't want to explain all this to a client because you don't make enough money on dental to spend too much time selling it. So you sell the Advantage Plus, and if they go in network, great. If they don't go out in network, great. We'll still pay 50%, the client is happy. What you don't want to do is sell the network version to a client that is not going to go in the network. Because when the bill comes for $1,200 for that crown, and we only pay for $379, that client is going to call you and is going to ask you, what did you sell me? Why did you sell me a policy that you told me was going to pay for half of the service and they only gave me $379? Oops, you went out of network with a network product. So what I'm saying here is, if you want to offer the network, make sure, if you're going to sell the network product, make sure that they are going to use it in network. Otherwise, sell the other one and you never have to answer that question. Simple. Let's talk about the vision really quick, and then I'm going to work on the process and why it is very easy to work with us. What we did with vision, there are two networks here. You have the IMED network, and we call that the Primestar Select plan. And you have the VSP network, we call it the Choice plan. In this case, it is very important that you ask your client, where are you going to go get your eyes checked? Who is your eye doctor? Where are you going to buy your glasses at? That is very important because you don't want to sell these plans without knowing that first. You got to sell the right network based on where they're going. The good thing about IMED and VSP is that between the two of them, you pretty much have everybody covered. IMED is better known for being the type of network that is on the malls. The LensCrafters, the Pearle Vision, Target, Sears, JCPenney, that type of big retail store. That's what IMED is better known for. But they are also now getting into the private sector as well, private eye doctors. The VSP is better known by private doctors, and you also see a lot of people that came out of a group policy. They're more used to using VSP because that's better known in the group space. With any network, regardless which one they buy, whether it's the IMED or the VSP, they're going to get additional discounts because it's like having a discount card and an insurance card combined. So if they want to get LASIK surgery or get different pair of eyeglasses, a separate pair of eyeglasses, they will get additional discounts. Let's talk about the features on the Select plan that utilizes the IMED network, their big retail chain. What we do here is once a year, we allow you to go to get an eye exam. And what you do, you go in network and you pay $25 for the eye exam. That is your copay. Everything else will be covered by the plan. To give you a reference, an eye exam costs somewhere around $100 to $150. In this case, the client will pay $25. Everything else is covered. An eye exam really means not only measuring your sight, but also looking at the health of your eye, where they go in there and they look at your muscles and they dilate your pupils and they look at the back of your eye to make sure it's healthy. So it's a true eye exam, not just measuring the sight. That's why I'm saying the average cost is about $100 to $150. They will pay $25. If they want to get frames or contacts, they'll get an allowance of $130 immediately and then every other year. So every 2 years, you can buy a new pair of glasses. And the lenses will cost you $25 for the copay, and we'll put the lenses on it. So if you go to the mall, go to LensCrafters, you get an eye exam, you buy a pair of frames that are within your allowance, and you put lenses in it, you're walking out of there paying $50. Now, if you buy frames that are $200, you're going to pay the difference, of course. And maybe you want to do something extra. You want to add the UV coating to your lenses, then you pay an extra $15. You want to do the anti-reflective coating, it's an extra $45. So you can see the copies in here. The price for this product is roughly $10 per person, $20 for 2 people, and $30 for a family. And a family can be 1 child or 5. It doesn't matter. It's the same price for the family. These rates are national, so they are the same rates regardless of where we are. These products are approved in about 42 states, so please do check the product availability. There is a handful of states, the more difficult ones to file, that are not available yet. We have filed them, we just haven't got the approval yet, but we're getting there. Texas does have it, by the way. The VSP plan, very similar. The copies are smaller, $10 for an eye exam instead of $25. The allowance is $150, and this is every year. So you can do the eye exams and the lenses or frames every year, not every other year. So more frequent, a higher allowance, a smaller copay. Guess what? Higher rate, of course. So this one is $16 for 1 person, $30 for 2 people, $45 for a family. Now, you can argue with me that the BSP plan is stronger, because it is. It's a higher allowance, lesser copays, higher rate. It's a stronger benefit. But it's only a stronger benefit if you sell it to somebody who is going to go into the BSP network. So please, if you know they're going to the mall to LensCrafters, don't sell them this plan. You're not helping them at all. Sell it based on where they're going to go, not based on the features and benefits that I just went through. Wonderful. Now, who is a client for you? Literally anybody who doesn't get dental or vision through their employer. They are a potential client. So there it is. The opportunity is huge. Tons of people. We also have recently launched a new self-service portal for the clients. So when your client buys a policy, they get an email about 2 hours later saying, hey, welcome, by the way, you can check your policy information online, you can register online, you can edit your personal information, or maybe change your payment method. You change credit cards, bank accounts, whatever it is, you can change that online. You can add dependents, maybe you have a new kid you want to add or remove. Request an ID card, you lost your ID cards. Whatever it is, you can do it online. So pretty cool tool. In terms of the agent portal, where you can view your commissions and your business, because we built a new system and we're in the building process, we won't have anything available for you until 4.1. That is the initial version of it coming out. It's going to come in phases, so more and more will be added to it. But 4.1, you will start seeing something where you can view your production online. Today, the only way you can see your production is on a commission statement that goes out the first week of every month with the production for the prior month. So we pay monthly, and the commissions will be on that statement for the prior month. Again, it's only a couple months away before you'll have an agent portal where you can see your production online as well. But the clients already do. You can see benefits and the whole 9 yards. Okay, so the information is on the screen, but now I'm going to talk to you about the selling experience, and I'll come back to this screen so you can send us your questions. What I want to show you is what happens when you get appointed with Security Life. So basically, you call the brokerage, you call Daniela, and you say, hey, I want to get appointed with Security Life, and I want to get that hyperlink that Diego mentioned. Well, this is what happens. We'll send you an email within 24 hours, and you'll have a little link and a little button. And you can use this link to put it on your email signature, you can put it on your website, you can email it to a client, you can just keep it on your computer and enroll people yourself. It's a consumer-friendly tool. People can use it online. It's awesome. I'm going to show it to you in a second. But that's how you get it. Get appointed, you get it. There's no cost to you. We pay for appointments, so it's just, why not? As soon as you get the hyperlink, now I'm going to give you a demonstration. Let me go into the internet, and basically it will look something like this. You open the link, and I'm going to just use the Security Life one here to show you. You open the link, and voila, something like this will happen. Your agent information will be in here, your phone number, and by the way, you see the chat function right here? You can chat with our internal team and ask questions. Hey, I have a client who has this issue on tooth number 13. Do you guys cover that? So whatever it is you want to ask us, you can do it online. So at this point, all you need to do is write a zip code, wherever you are, with your zip code, your client's zip code. You're selecting here whether it's one person, 2 people, or a family, dental or vision. I'll show you both, but I'm going to start with vision. And you select the starting date. You can do it tomorrow, or maybe the client says, you know what, I don't get paid until the end of the month. Can you bill me on the first day of every month? Of course. So you can do the first as an effective date. That's up to you. And then you do see the plans. Again, you can send this to a client and they can buy it themselves. You can do it for them. Once you learn it, it's going to take you 2 minutes. So you see the 2 plans. You have the PrimeStar Select and the PrimeStar Choice. The first bullet utilize an IMED access provider and or a VSP provider. If you want to view the details of the plan, you go here and you have all the copies that I show you on the presentation. I'm going to go ahead and close that. Okay. Now, what was the question? Oh, yeah. Where are you going to go? Let's find out. So you click the link, you type the zip code for the client, and it is the Access Network. It says that on the link. Get results, and you will see in here a list of all the different stores near Shakopee, Minnesota, where I live near Minneapolis. And you have all the different stores, and the private doctors are on the left side, and the retail spaces are on the right side where they can go. So it's that simple. If you have a name, you can put the name in here and look it up by name. You can do the same thing on the VSP. I'm not going to do it for sake of time, but it's the same experience, and you can find a doctor and whatnot. So let's go ahead and purchase the select plan in this case. This fellow is going to come out, smiling, of course, and reminding you about the dental plans. If you buy a dental first, there is a lady wearing eyeglasses that will remind you about the vision. So we were thinking here. So view dental plans. And the first thing you see is the plan that you selected, the select plan, the vision plan. And here are the dental plans. Advantage Network, and you can see the price in Minnesota. Depending on where you are, it may be a little more, a little less. You can see the two Advantage Network, Advantage Plus Network. And if you keep scrolling down, you're going to see Advantage and Advantage Plus. Remember what I say, if it says network on the name, you have to use it in the network. What is the first bullet say? Designed for those who will utilize the maximum care provider. In the Advantage up here, the one that doesn't say network, it says freedom to choose any dentist. Just like I told you, go whatever you want. But you can also use the maximum care network. So if you happen to fall in a dentist that is in the network, you still get the benefits of the network and the discounted pricing. That's why I say, sell the Advantage Plus. It's the best plan, it's the best coverage, it's $40. Make it $2,000, it's $49. Sell that, start with that. If the client comes back and says, I love the plan, the $2,000 a year sounds good, the coverage is pretty good, everything about it, I like it, but $49 is a little more than I wanted to spend on a dental plan. Okay, let's do something. You go down here, you take the Advantage Plus Network, you change it to $2,000. So I'm going to click that button. Now the price changed to $34. You see how it was $28? Now it's $34. And you go, okay, I tell you what, you like that Advantage Plus and everything about it. What if I can give you that plan, instead of for $49, I'll give it to you for $34. Okay, how? There's only one catch. You have to use it with a dentist in the network. Really? Well, let's find out if your dentist is in the network or if there is one that you can go to it. So you go to the link just like we did on the vision. And in here you can type the client's dentist name and check that way. Or you can type the zip code 55379 and search for providers. You can print the list, bring it with you to the appointment. You can email the list to the client. Actually, I will email it to myself and then forward it to the client so it comes from you. And you can see, for example, in Minnesota where I am, I'm going to do 100 providers. And within 0 miles of my zip code, there is all of these people. Look at that. Keeps going and going and going and going and going. And at some point down here, it's starting to get farther away. Okay, now it's 4.8 miles. So plenty of dentists are in the network. And if you're in Texas, trust me, they're everywhere. If you're in other states, it's still a very good network. But if you're in North Dakota, it's not so good. So, check your area. But if you don't want to talk about network because it takes too long, it's too difficult to explain it, then don't. Sell the Advantage or Advantage Plus and hope that they go into the network. This is a backup plan. It's very easy to come up and say, hey, I have a plan, it does all this for you, and it's $49. And then if that fails, if they buy it, good. You close it, you sell it, you're done, you leave. If that fails, then you can always come back, well, what if I give you the same thing for $34? So it's very easy to go down and close the sale. But if you start at $34 and it didn't work because the dentist wasn't on the network, now you got to sell them the $49. That's a lot harder to do. So my recommendation is to start high and go lower later. You look like a hero. All right. So I'm going to go ahead and add the dental coverage. And go to the tab and you say proceed to the checkout. Now I'm taking my time doing this because I'm showing it to you. Once you do it 2 or 3 times, you're going to rush through this. It's going to take you 2 seconds. So I'm going to go ahead and make some information up because I want to show you the whole experience. So I don't really need to type much. And we have a bit of birds here. In here, you will put the client's phone number and email address. That way, the client will get a confirmation of the purchase. If the client doesn't want to give you the email address, fine. Just put your own, print it, give it to them. On the right side, you can see what you're buying. You're buying the Advantage Plus Dental, the Prime Star Select Vision. You have the Dental Premium, the Vision Premium, and the Monthly Premium. So you continue. And then, how are you going to pay for it? It's that simple. Credit card, they want to give you a check, write the check information down. So I'm just going to go with the credit card for now. All right. So just, put in the credit card, whatever that is. And if you go down to the bottom, in essence, you should be reading the authorization agreement. Basically, do you authorize me to charge your card? And you also should be reading the fraud notice. The limitations and exclusions, you don't need to read it because that is actually provided to the client with the policy. So you check that you did that, you review the summary one last time. The dental outline of coverage and vision outline of coverage is a compliance thing. So give that to the client, check that you did, and you submit the application. It's that simple. The confirmation comes through. At the same time, you are going to get an email. You, the agent, will be receiving an email. And also your client, if you use your client's email address in that box, will be getting an email saying, well, actually, yeah, I just got the email. The window pop up, so I'm going to show you. This is actually email for the transaction that I just did. So as the agent, I got the enrollment confirmation, and it says in here, thank you for your purchase, blah, blah, blah. This is the premium. So the email just came to me because I was actually doing a live transaction with a fake agent number. So that's the email, as you can see it. Okay? Well, here it's a little bigger. The good thing about this email is that it has the contact information. So if a client needs to go to the dentist the next day and they don't have their ID cards yet, they can bring the email, they can call Security Life, give us their name and date of birth, and we'll verify coverage. That's simple. Most people don't do that. They don't go the next day. And by the way, once whatever you select for an effective date, after the effective date, it takes about a week before the clients will see the policy and the ID cards. So a week from the effective date, not from the sales date. Just keep that in mind. So that's the confirmation and experience right there. Now I'm going to go into the presentation again really quick. And I'm going to show you the contact information. You can see my name on the screen. I'm Diego Coy. The Sales Connect team is here to help you and support you. Daniela at the brokerage and the brokerage team, they have a series of great marketers over there. They're also there to help you. So please call the brokerage, get appointed with us, get your hyperlink. If you don't have, if you are already appointed with us, thank you. If you need your hyperlink, contact the Sales Connect team. Just send us a quick email. We'll send it back to you. We'll send it to you again and again, as many times as you need it. We really look forward to working with you. We believe this is a very easy process. It will take you 3 minutes to enroll a person. You'll find out that the benefits are strong. It's a great door opener, and I really, really hope that you give us the opportunity to do business with you. So thank you very much. Daniela, is there anything you want to say before we leave? Or are there any questions that we have?
That was great, Diego. No, I've been answering the questions as they've come up. If you have any questions or anybody has any questions on the webinar, go ahead and type them in now, and I can send you a follow-up email with the response, or you can always give me or Diego a call later. I'm going to be sending out a follow-up email with the recorded webinar and a link to all the material, so you can kind of take a look at what Diego kind of touched on and see all the plan brochures and rates for your area. And if you guys, go ahead.
Yeah, and I'm going to send you, Daniela, an email template, a sample email that agents can use when they get their link. They can send that to their existing clients or potential clients. And that's sometimes all they got to do is send an email with a link to their hyperlink, and the clients buy it, and they get money. So it's very simple because it is a consumer-friendly tool. So I'll send that to you to send to the participants as well.
Awesome, that sounds great. And then Diego, Catherine had a question for you. She wanted to know if the ID cards are mailed or sent by email to the client.
They are mailed, so you actually get a physical card. You know, it's a nice laminated, you know, hard plastic card that you get, and you just, you know, it's perforated paper, plastic paper. So you get the cards, put it in your wallet if you want to, and use that. But again, if you don't have the ID card, they can always call us, and we'll verify the benefits over the phone. Now, they can also go online, the dentist's office, and verify that, and it's all in the ID card. So it is sent to them about a week after the enrollment date, or the effective date.
Perfect. All right, and then one more question just popped up. They wanted to know if there is a missing tooth limitation.
Well, implants are not covered on this plan. Unfortunately, that is very rare in the industry to cover implants. The only thing I can tell you is if somebody does buy the policy and they go into a network provider with one of our plans, they will get at a minimum a discount on that, but the insurance portion of it will not cover it. That's very rare to find.
All right, and then another question, when is the payment charged?
The day that they select as an effective date. So if they select the 15th of every month is when we will be taking the money out of their account or their credit card.
Okay, and then I have a clarification from the previous question. He's saying not implants, but a bridge or dentures when there are already missing teeth. I'm
sorry. Yes, yeah, dentures are covered. Absolutely, and bridges are covered as well. Yeah, that is covered.
So is there a limitation on how many are allowed per calendar year?
There is one, and I don't know it top of my head. I think I don't know it. I will have to check back and get back to you on that. So.
All right. So we will follow up with you on that one.
I will follow up on you.
Okay, perfect. Well, if there's any more questions, then go ahead and keep typing them in, and I will give you guys written responses. I'll also include those questions that we just had with the written responses on the follow-up emails. And again, feel free to call me or email me. My information's on the screen right now. I'm Daniela here at the Brokerage Inc. And Diego, thank you so much for taking the time to talk to us about these wonderful products. That was an amazing presentation, and it was very, very informative, and I'm sure everybody on the line really appreciated it.
Well, thank you very much, everybody, and I look forward to working with you.
All right, thank you, everybody, for coming with us on the line, and like I said earlier, keep your eyes open for an email. I'm going to be sending you a lot of good information your way, including the answers to the questions, the recorded webinar, and materials. Thank you, everybody, again, for coming on the line, and hope you guys all have a good rest of the day.
Bye-bye.
Bye. Thank you.